This woman has struggled with depression and anxiety her whole life. At times, she's felt so discouraged, she contemplated suicide. She's tried medication and alternative medicine that sometimes eases the pain, but not forever.
I am currently on medication. I have been for the last 20 years. I did make the decision to try wean myself off medication, and I lasted 4 months and I had to go back onto my medications. I take something for depression as well as something for anxiety, and the anxiety medication just allows you to relax and fall asleep and remain calm during the evening so that you have a good night's sleep, because anxiety and depression is a vicious cycle. So if you're not sleeping and you're tired, you become anxious, and when you become anxious, then you become you then start to become depressed because you're unable to complete your daily tasks, you're unable to cope with day-to-day life, and it becomes this vicious circle where the one feeds off of the other.
A recent Human Sciences Research Council report shows that 33% of South Africans are depressed, 45% fearful, and 29% lonely. The figures are similar to those reported in other Brics countries where mental health issues are on the rise. And since the COVID-19 pandemic, the numbers have increased further.
A lot of our calls were around relationships. I can't handle my children, I can't handle my husband, I can't handle my wife. Everybody was living under the same roof. So that was quite interesting. It was quite a change and a very significant bit of time of calls that we noticed. And of course that even starts to affect one's mental health, because you're stressed out, or you're anxious, or you're concerned. Fast forward where we are now. We're now sitting at over 2,500 calls a day.
Historically, mental health has been largely neglected by the health sector. Factors like unemployment, pandemic lockdowns, ongoing electricity blackouts, and the high cost of living all contribute to it. Across the globe, governments and health organizations are aware of the scourge. The World Health Organization has gone so far as to issue a mandate to governments to act on the matter. But still, victims continue to suffer, often in silence and in pain.
For a long time, mental health has been ignored or left behind compared to other health challenges. And sadly, it's a growing problem that the world is facing. And I think it will be important for governments to prioritize mental health by also putting adequate funding to support the work of mental health. So mental health should really be integrated as part and parcel of the health care that is being provided. In any case, WHO defines health as not just an absence of illness or infirmity, but a complete state of well-being, including mental health well-being.
In South Africa, it's unclear when will the population have access to promised mental health care services. But one thing is clear, there's a desperate need for clinical psychologists, and sooner rather than later. Ingam Zileni, BGTN, Johannesburg.